Right now, the U.S. is recording as many COVID cases as it was late last summer during the Delta surge, but restrictions and mitigation efforts look much different this time around. According to the CDC, the highly transmissible and contagious BA.2 Omicron subvariant is now the dominant strain in the U.S. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're discussing the BA.2 variant and how to plan for a safe summer as masking and other restrictions are less common. With me today is Dr. Sarah Boyd, an infectious disease physician on St. Luke's COVID-19 response team. Thank you so much for joining us.
Thank you for having me.
So first, Dr. Boyd, what are you seeing right now with COVID as the BA.2 subvariant continues to spread?
So in the last few weeks, we are starting to see more cases again circulating in the community. We have noticed a small increase in the number of patients in the hospital, but we also know that typically hospitalizations have lagged behind people getting infected a couple of weeks, and so we're certainly watching to see what happens from those patients that might get severe illness.
So what should families look for in terms of symptoms? Have they changed at all?
So symptoms really have stayed the same. Some variants, people might report that they have more sore throat, or maybe it's more common to notice that loss of taste and smell. But really, any patient can get any of those symptoms. So any symptoms at all, we would encourage someone to take a home test or to get tested just to be sure.
Okay. So what should people know about vaccines and booster shots when it comes to this variant?
So our vaccines are safe and highly effective. We've had billions of doses given. However, we knew when we began to see Omicron back in the winter that booster shot was really critical to continue to keep those highly effective responses that we saw with the original variant. And so I would encourage anyone that is unvaccinated to consider getting vaccinated, but then also if you're due for your booster shot, to get out and get your booster dose.
So what about the younger age group?
So certainly younger children, we know kids under 5 are not yet eligible for vaccination. It is anticipated that this summer they'll be reviewing that data and making a decision if they're going to begin rolling out COVID-19 vaccine for that age group. Additionally, those older school-age children, the age 5 to 11, it has now recommended that they go ahead and get a booster dose. And so I would encourage people, we offer those booster doses in our clinic, and I would encourage people to go ahead and get that booster done if they're eligible.
Okay. Now, despite the rollback of mask mandates, are there certain situations when people should still consider wearing a mask right now?
So certainly patients or people who are at high risk or maybe live with someone who is at high risk, I would consider masking when you're indoors, you're unable to socially distance. And then additionally, when you travel, it's very important to be aware of how much COVID is circulating in those other communities, because when we travel, we may not know what the local health department recommendations are. We may not know if there are local mask mandates or even just the number of cases that are circulating in the areas that we're traveling through.
Okay, so what are we seeing here in Kansas City as far as community levels and the community transmission levels?
So there's kind of two different graphs. When you look at CDC, they talk about that community transmission level, and we're still in the lower risk area. They changed how they measure those cases and make up that decision, is it low, medium, or high risk, a few months ago. It looks at number of cases, but it also takes into account how many COVID cases are in the hospital in the region, and then as well as how busy the hospitals are. So is there a bed available if you would need to seek treatment for severe COVID? We're still in the low green level on that map. However, we know that when you look at just the number of cases circulating in the community, that we are seeing a high number of cases. And from our standpoint in the health system, we're looking at that to really know how many people are becoming infected and are at risk for more severe illness after that infection.
Okay, that's good to know. So what are things people should keep in mind as we head into summer?
So as we head into summer, I think it's important, particularly with travel, again, to sort of know where you're traveling and how much COVID is there. And then additionally, activities that you may do on vacation, large concerts or indoor larger events that maybe you don't do on a day-to-day basis. So I think it's important for people to think about that. I think additionally to know that symptoms, if you have any symptoms, that you should get tested. Sometimes when we travel, it can be a little harder. And so someone might want to take some of the at-home test along with them or be aware of ways to seek medical care in in the place you're traveling to.
Okay. So what about post-COVID conditions? What are we seeing right now with those?
So we're learning more all the time about long COVID or post-COVID conditions. And certainly we know that some people have symptoms for a very long time after they've had infection. One of the more shocking statistics for me was really they've come out with information about patients that are sick enough to be hospitalized with their COVID infection, that 20-25% or more are having some of these post-COVID conditions that linger for a long time. And so I think it's important that people prevent infection in the first place, because certainly long COVID and some of those things can be quite debilitating for a longer period of time after just that initial infection.
Absolutely. Well, what's your final message for people watching today?
So as much as we want COVID to go away and be gone, it's still around. So I encourage people, if you have symptoms, to be sure to get tested. One of the most important things you can do to protect yourself is be vaccinated and to get your booster. And then still keep those masks handy and wear them if you're in places where you're unable to socially distance, or perhaps indoor in large gatherings, or when traveling.
Okay, great. Well, thank you so much for joining us, Dr. Boyd.
Thank you for having me.
To learn more about the latest COVID-19 updates, visit stlukeskc.org/COVID-19. You can also find updates on other health news at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.